This video will cover the appendicular skeleton, which includes all of the limbs and hands and feet, as well as the bones touching the limbs, which are the clavicle, the scapula, and the innominants of the pelvic girdle. The first bone that we're going to cover is the clavicle. And as we mentioned previously, the clavicle articulates with the manubrium of the sternum. It also articulates with the acromion process of the scapula, and it is generally referred to as your collarbone. The clavicle is actually a part of what's called the pectoral girdle, which consists of the scapula as well as the clavicle, and it serves as the proximal base of the upper limb, as well as the anchor for the upper limb to the axial skeleton. The clavicle is really important for providing stability for your shoulder. So it's really important for swinging in the trees, which we will cover when we get to non-human primate locomotion. There are several landmarks that you will need to know, and you will need to know where it articulates with what bone. So this is the sternal end, and it is more bulbous and thicker, and it articulates with the manubrium of the sternum, as we mentioned. And then this posterior end is the acromial end, also called the scapular end. And this is more thinned out and flat. And the acromial end, or the scapular end, is always going to be facing posteriorly, and superiorly, it's always going to have a smooth surface. If you're trying to figure out superior and inferior, look for the roughened landmarks, and that is your inferior view. And the sternal end, the chunky bulbous end, is always going to be facing anteriorly and medially towards the midline of the body. Now we're going to talk about the scapula. And the scapula is generally referred to as the shoulder blade, and there are several landmarks that you will need to know. In anterior position, you can see the feature of the coracoid process. And this serves as an attachment for muscles and ligaments, and it sits anteriorly and superiorly, the coracoid process. Moving laterally, you will see here's the coracoid process from lateral view. This is the acromion process, and this feature right here is very important. It's called the glenoid cavity or the glenoid fossa. It's very important because it articulates with the head of the humerus. It is always facing laterally, and so when you find the coracoid process, you always want to place the coracoid process anteriorly, and you always want to make sure the glenoid cavity or glenoid fossa is facing laterally. That's how you're going to be able to side your scapula. So the glenoid fossa or glenoid cavity is always facing laterally because you're going to want to have your humerus articulate with your glenoid fossa or cavity. And you would never want your humerus, your arm bone, facing out the other way, right? That wouldn't be in its socket. So you always want to make sure the glenoid fossa is facing laterally so that you can receive that head of the humerus. This is in posterior view. So in posterior view, there are other features that you will need to know, one of which is called the scapular spine. And so this is what you're feeling on your back right now on your shoulder blade, is your scapular spine. The end of the scapular spine is called the acromion process. And this is where your scapula articulates. And remember, we are looking at this in posterior view. So if we were to turn this around, the last three landmarks you should be aware of are the body, and that's the main part of the scapula, the axillary border, and that's the border that is lateral, and the vertebral border, and that's the border that is medial, because it's closest to the vertebral border. I'm going to provide a tip of how to side the scapula. So as mentioned, the glenoid fossa is always facing laterally, correct? And the spine is always facing posteriorly. So what I usually do is I envision grabbing the scapula, putting it on my back, and having this glenoid fossa point towards my arm. And so if the spine is pointing posteriorly and my glenoid fossa is pointing laterally towards my arm, then I know this is in the right spot, right? This is my left. Now we're going to talk about the arms, wrists, and hands, which include the humerus, the radius, the ulna, carpals, metacarpals, and phalanges. So we will start with the humerus, and it articulates with the glenoid fossa of the scapula on the proximal end, and on the distal end, it articulates with the ulna and radius. There are several landmarks you will need to know, one of which is the head, and that is always facing medially. The other is the neck, and so just like your neck is under your head, the humerus's neck is under its head as well. This is the shaft. In posterior position, the landmarks that you will need to know are the olecranon fossa, which is where the olecranon process of the ulna articulates. And this portion makes up your elbow joint. So if you feel your elbow right now, that is what you're feeling, your ulna. Another landmark that you'll need to know is called the medial epicondyle. And so if your head is always in medial position, then the feature that's pointing in the same direction as the head on the distal end is also going to be medial. So this is the medial epicondyle. And so this landmark on the other side of the medial epicondyle would be what kind of epicondyle? That's right, it would be lateral. The last landmark that you will need to know on the posterior side is called the trochlea. This actually is also on the anterior side. So now let's switch to the anterior. So here is the trochlea on the anterior side. So the capitulum on the anterior distal end of the humerus is an important landmark because it articulates with the head of the radius. And so together with the humerus, the radius, and the ulna, this forms your elbow joint. Now I'm going to give you a demonstration on how to side the humerus. So this is the humerus, and you have to find the head of the humerus. The head of the humerus is always pointing medially. And so is it this side or is it this side? How are you going to tell? What you're going to look for is an indentation in the distal end of the humerus, one that is quite deep. So if you look here, you don't really see a deep hole. If you switch to the other side, the hole is much deeper. So when you find that deep hole, that's actually the olecranon fossa where the olecranon process articulates. So that's your elbow. That's where your elbow is going to hook in right there. So that means you're going to want your elbow facing posteriorly. So the olecranon fossa is going to face posteriorly, which means this is my left humerus. Now we will cover the bones of the forearm or the lower arm bones, which include the radius and the ulna. The radius is lateral to the ulna in anatomical position. Landmarks on the radius that you will need to know are called the radial tuberosity, which is an attachment site for muscles. You will also need to know the head of the radius, which, as mentioned previously, articulates with the capitulum of the humerus. The head is always proximal, and the distal end of the radius has the styloid process, which is an attachment for ligaments of the wrist. So the distal end of the radius articulates with the carpals, or the wrist bones. I won't make you side the radius because that's quite difficult, but you will need to know what's distal and what's proximal, and what bones articulate with the radius. Now we will discuss the ulna. The landmarks that you will need to know on the ulna are the olecranon process, which articulates to the olecranon fossa of the humerus, and the coronoid process for the attachment of muscles. In addition, the semilunar notch. On the distal end of the ulna, there is a styloid process just like the radius, but it doesn't serve a function. The important features are going to be on the proximal end for the ulna. And so the distal end of the ulna articulates with the carpals as well. Now we will move on to the carpals, or your wrist bones. And I'm not going to make you remember each name of each individual carpal bone, but you will need to know what bones they articulate with, such as the ulna and the radius, as well as the metacarpals. And you will need to know how many there are. So let's count them together. 1, 2, 3, 4, 5, 6, 7, 8. So that 8th carpal is kind of hard to see in the posterior view, so this is the anterior view, and that's how you're going to see that 8th carpal. Now we will move on to the bones of the hands and fingers, or the metacarpals and the phalanges. So as you can see, the metacarpals are the bones of the palm of the hand. Oftentimes students confuse the metacarpals with the phalanges, but we have to remember that these bones right here comprise your palm. Now we'll move on to the phalanges, or the finger bones. There are 3 types. Proximal phalanges are the finger bones that articulates with the metacarpals. Then you've got intermediate phalanges, and those are the finger bones in the middle. And then you have distal phalanges, which are the bones that make up your fingertips. And so your thumb does not have an intermediate phalanx. So it only has the proximal and distal phalanx. So you will need to know the number of proximal phalanges, the number of intermediate phalanges, and the number of distal phalanges in each hand. So in one hand, there are 5 proximal phalanges. There are also 5 distal phalanges, but there are only 4 intermediate phalanges because the hallux, or the thumb, is lacking that intermediate phalanx. Many people assume that this bone right here is a phalanx, but it's not. That's a metacarpal. So always remember where the palm bones are versus the finger bones.